Hi, this is Roxanne and Linda. Some of you are newer to us, and some of us have been here for quite a while. But we decided this year, instead of just making a mock breastfeeding quiz up like we've done in the past, that we would do a little video. So we're going to ad-lib this. It's okay to laugh. There will not be an evaluation of the instructors on purpose, but we hope that you learn a lot today. So we're going to start with a mama who just delivered maybe an hour or two ago. She probably had been shown a few things, but maybe not. Maybe this baby was a little sleepy. So I'm walking in the room, and this new mama, Roxanne, with her first baby, is skin to skin. We always want to do skin to skin for many reasons. Stabilizing heart rate, stabilizing temperature, helping the baby's respiratory rate, and giving mom a chance to do some bonding with her baby. During the recovery phase, I know as a nurse at the bedside, you're very busy, but helping her to get skin to skin, possibly showing her how to hand express and talking about a feeding, which might happen in the first few minutes, but it should happen within the first half hour or so. We're going to help you with a few hints to make you feel more comfortable and confident, because mothers need reassurance and a lot of positive reinforcement that helps them to get things off to a really good start. So this is a term healthy baby. We didn't have to do glucoses, and I'm going to go over the hand expression quickly because that can be a great segue into helping her to latch. So this is the mom's breast, obviously nipple, areola, and you want to say to your mom, do a little gentle massage. So Roxanne is going to gently hold that on her chest, and you're going to just have the mom do a little massage. We're not kneading a loaf of bread. It's simple, little massage. Then I always say to my moms, 3 simple words: wide, which is placement of her hand outside of the areola circle. So wide, deep, squeeze. And I'm going to show you that from the side. Wide, deep, squeeze. And it can take a few. It's not going to be instant, which it might be with some moms. But a first-time mama, wide, deep squeeze. So now this mom has got a little colostrum out there. We teach her how to frost the cupcake. Yes, that's my signature line. You don't have to take it, but you can use it. And now this colostrum on the nipple. Babies have a very, very strong sense of smell. So when we put our baby over for that first latch and following with latches, it's going to help. So the mother now feels confident. She's got colostrum. We're going to do a traditional hold, open arms, one arm down, one arm up. Instruct the mother to support her baby's bottom, back, and shoulders. We want to kind of tickle the lips of the baby with the nipple.
Up here?
Nope, at the shoulders. And then when the baby opens wide, we want a nice, wide, deep, comfortable latch. So Rox is going to imitate that. So latch the baby.
Touching the nipple, just below the baby's nose.
Correct.
Brushing down towards the chin, waiting for that wide open mouth.
And then
bring the baby on.
And then have mom relax back and tell her, good job, take a deep breath. Partner, this is a great time to say to partner, this is awesome, praise her. Remind her to take a deep breath.
Relax her shoulders.
Relax the shoulders, offer a sip of water. Make sure she's comfortable with a couple of pillows.
Partner can get those pillows that she needs. I do like to remind mothers to support their breast during the feeding, because it puts their thumb in a really great spot for doing some breast compression to facilitate the transfer of milk.
Yeah.
It really just makes, they're a good team, mom and baby.
And I find most first-time mothers do have to hold their breast because it helps them with position and getting that comfortable latch. Because if things start off well, it's probably going to continue on a good path.
Yeah.
So this is a good time to quickly just mention the breastfeeding packet. Like I said, I've been there. I was a labor and delivery for many, many years. I know your recovery time is busy as the nurse, but this is helpful and it helps your workload because you can mention the breastfeeding packet. Have the partner and mom review it when they're in a good place. On the other side of the yellow sheet, there's actually two sides. Sometimes our moms don't realize that. The Dear Parent letter is an introduction. It gives them a good baseline of what to expect in the baby's first few days. The other side, obviously, is a little feeding log. I suggest that they look this over, try it for the first week, because it'll give mom confidence. She's also tired. She won't remember when she last fed. She's exhausted. So partner can do the charting, partners can do the water, a snack, and support her. So that is a huge way to help them as a team get off to a good start. Now the baby's been breastfeeding for a little while. I'll say to the mom, does it feel like some gentle tugging? It should not feel painful or pinchy. Now we're gonna just quickly go into the different positions. So sometimes we have babies with a tight jaw. Rox and I usually suggest the football hold because the jaw will lower towards gravity producing positions towards the floor. So the baby's jaw will open better, sometimes in the football hold. So Rox is gonna delatch her baby, stick a finger in the baby's mouth, take the baby off the nipple, and now we're going to try a football hold on the other side. So we're gonna bank up some pillows for mama. The baby should be at the level of her breast, not below. We're going to put the breast back in place. And same little tips, tummy to mummy in all of our positions. Arms open, which brings the chin into the breast. And now,
so don't tuck the arm
right,
like this. That can make the baby feel really uncomfortable.
Open arms.
Trying to keep them in a nice, natural position.
And same tips, express a little colostrum, wide, deep squeeze, tickle the baby's nose and lips.
Rub it into the nipple.
And then get that baby on.
Brush down. And brush down. It might take a couple of tries. And then when the baby opens wide, bring the baby
in. Same thing. Comfortable shoulders. Take a breath. Settle back. Keep your baby nice and close. Some of you often say to me, she's a multip. She's forgotten how to do this. She keeps holding the baby too low. Just remind her, so you know, babies can't get there on their own. Help your baby with the shoulders. Keep your baby's nose and chin into the breast.
I like to say that babies need guidance.
Yes.
And when you have a multip who's going back to that newborn stage, especially if she nursed for, until the baby was a toddler, they forget about those things that they need to do.
Absolutely.
Expressing the colostrum, encouraging that wide mouth, bringing the baby in. Lots of times you nurse a toddler kind of just lean in whenever the baby wants to nurse. So it's important for them to have those reminders and know that that's just a normal kind of thing that they remember.
So let's just do reclined. Reclined, most first-time moms have to latch their baby, then recline, at least I find. So we're gonna latch your baby, okay? So breast up, tits out. We never use
Don't
that
say
word.
that.
That was a joke. Okay, so breast, latch, and then we're gonna try a reclined position. So we're just gonna put the head of the bed back. And we would support mom's head and shoulders. And we're gonna do the reclined. Now if mom just had a C-section, this might be a little bit more challenging for her, but find a place where she says, oh, this is more comfortable. And sometimes babies might even just be a little more vertical. So this is another one to try. Side lying is a little bit more challenging, I think, for especially first-time mamas, and especially if they've had a C-section. But you could do it if mom was already going to position onto her side, and then put the baby in, tummy to mummy. Arms are down by the baby's side in that position. Turn the baby towards her and tuck a little something, small little receiving blanket behind the baby's bottom. It can be a nice one to do at night when mom is tired. But bottom line, skin to skin, express colostrum. increase her confidence, tell her she's doing a great job, and make sure we have a wide, deep latch. Those are very important. And just like the breastfeeding introduction letter says, the average is every 2 to 3 hours and about 15 to 20 minutes on a side. But in the first 12 hours or so, this might not happen. Maybe it was a longer epidural. Maybe our baby's really tired and mom is exhausted. So we don't like to push pumping or too much aggression or assertiveness in the first 12 hours. Give that mom and baby some skin-to-skin time. There will be time for pumping and bringing out some other tools and products. But in the first couple of hours, really encourage that bonding and that skin-to-skin time, which is so important.
And hand expressing the colostrum. If the baby's not showing any feeding cues, keeping the baby skin to skin and just expressing small drops of colostrum onto mom's nipples will help the baby to start waking up a little bit, searching for the breast, and utilizing the reflexes that they're born with to guide them over to the breast, using their hands to push, lifting their head, sticking out their tongue, rooting around and searching. But it's really important to give the babies that opportunity.
And if you want your baby to start breastfeeding, you got to keep the kid in the kitchen. So when we walk into a room and the baby's all swaddled and in the crib, all cozy, and mom says, yeah, the baby hasn't fed in a few hours, well, the first thing I like to do, put up a little bit of light, undress the baby, do a little back massage, get the baby awake, and then show mom how to hand express. And honestly, guys, hand expression, when they see that liquid gold drop by drop coming out, it's a huge adrenaline rush. They're like, oh my God, I have milk. I had a mom weep the other day. She was going home. She said, I don't think my milk's in. I'm looking at this bulging veins in her breasts and I'm like thinking, yeah, you're 2 days. I bet it's there. So I showed her. She started to cry. She's like, I didn't think I had milk. Oh my God, this is amazing. So I should hear more swallows? Yes. And it just was going so well. And it's just basic steps. So now we're going to talk about some tools in our next segment. And so maybe the first one would be the flange size, and maybe she needs a shield.
Do you want to talk about what a good deep latch looks like, feels like, and what
Look, listen,
and feel, and what
Perfect.
the nurses should be teaching the patients to do with each and every feeding?
Okay, she's on.
Okay.
So look at rocks.
So when you're in the very first couple of feedings, it's important to tell your patients and to teach them what a good latch looks like, and how it should feel and what it should sound like. Look, listen, and feel. And I love to bring the partners in for this portion as well, because they're hopefully going to be their number one support at home. They're extra eyes, extra hands, and so it's important for them to be able to have those words to support mom or the patient with. So when the mom has gotten the baby latched, I like to point out, and we'll use the reverse cradle for this demonstration. The baby is latched, and I like to point out the alignment of the baby's head and body, right? You should be able to draw a line from the baby's ear down to the shoulder and then down to the hip. Really, baby's belly is touching mom's belly, and the nose and chin are pulled right into the breast. And a lot of moms will say, oh, well, I don't want the baby to suffocate while it's there. They can gently hold back their breast tissue, but it's just important to remind them not to keep that constant pressure there, because if they get into the habit of it over time, long term, they could develop plug ducts. But just having that gentle kind of retraction away from the nose will help to keep the nares open.
And
so
sometimes the baby's breathing fine, and I just remind the mother, if the baby's suckling, the baby's breathing.
Right.
And if the baby can't breathe, the baby's not going to suckle.
They'll choose breathing over eating.
Right.
And so they will actually try to pull themselves away if their nose gets blocked.
Yeah.
The other thing that mamas can listen for is they can listen for breathing through the baby's nose. If we're nice and quiet, listening to a feeding, you should be able to hear that. And then the other thing that you want your parents to listen for is swallowing. In the first few feedings, it may be very, very quiet, so that if the television is on or they have music playing or the refrigerator kicks in, you're not going to be able to hear swallows. So it's important to teach parents to pause with each feeding and listen. And as the baby is suckling, the pattern of their suckling will change. When the baby first latches, they'll take a few sucks and then pause, and then take a few sucks and then pause. And then as the baby gets little squirts of colostrum into their mouth, they will pause their suckle and swallow. So it's like suck, suck, pause, and then suck, swallow, pause. Suck, swallow,
and sometimes I tell my mamas, it often sounds like a little k, like a K-U-H sound. It can be very quiet, and as the milk fills, then they hear their baby really drinking, and that's very reassuring to the mother.
Yeah, but it's not going to be gulpy in the first day.
Not right away.
Very quiet, little clicky breaths. And it's important to point those out as you're hearing them as the nurse, right? So that the parents can also be clued into that. So we talked about the look, we talked about the listen, and then we also want to talk about how it feels, both at the breast for the mother. Does it feel perhaps a little tender and snug, but comfortable? Or does it feel like there's pinching or biting? Searing pain is never normal, and you would want to teach the mom how to release that latch and then relatch the baby. But if the baby does have a nice wide open mouth, a deep latch, enough of the areola in their mouth, it should be mostly comfortable for them.
Like a tug.
Like a tug, a tender tug.
Yeah.
Yeah.
All right, so how about unlatching, and we're going to talk about nipple care.
Okay, so when you're teaching mom how to unlatch the baby, it's important to teach them as well, because frequently they will simply pull the baby away.
Baby off.
And the baby that has a good deep latch is going to try to fight them off for the nipple. Try to hang on, yeah. Yep. So by taking your finger, or the mom taking her finger and going alongside the breast into the corner of the baby's mouth, kind of hard to see on video, but as you go alongside the breast, the goal is to take your finger and wrap it around the nipple so that it will protect the nipple as the baby is removed from the breast.
And then we want to remind mother to do that hand expression again, because we want to teach her why deep squeezes, frost the cupcake, and let that colostrum air dry. So many times they put their bra flaps right back up, and they really should be reminded to help with soreness in those next couple of days. If they're getting sore, they've got to be reminded of those same steps. Hand express, wide deep latch, pay attention to the feeding, keep the baby close, unlatch their baby, and then do the nipple care again. So that's really important. But teaching them the hand expression, it does so many benefits, so many.
And colostrum is really like Mother Nature's nipple cream.
Yeah.
So if they are asking, do I need to use any extra ointments? I just tell them, no, their colostrum is there. It's wonderful. And it doesn't change the smell or taste of their nipple, which might actually disorient the baby a little bit. So by using their own colostrum, it helps to keep their nipples healthy and the baby stays oriented.
Okay. So how about if we go towards, sometimes one of you will come to Rox or I and you'll say, we've done all the basic initial steps, but the nipple's a little short and it's feeling a little bit sore to mama and we can't get a good latch. One of the first things that you may want to try is the manual pump. We can give the mother the manual pump to go home, which is another tool she's going to have. But sometimes just a manual pump for a few minutes, maybe 30, 45 seconds, maybe even a full minute, will elongate that nipple and make it easier for her to obtain a wide deep latch. So most of you should just remember that this is a good backup tool, okay, to try. Then we wanted to talk a little bit about sizing. That is something that gets better the more you practice it. But obviously we also have a little guide. We keep this in our breastfeeding cart. I'm going to let Rox hold it just a little bit closer to you. So most of the time, we can kind of visually guess what we're doing, but we know that some of you are very new to this, or you want more education or learning about it. So you can go and get this little tool, use it to size the mother, so that you could then help her with the flange size, because we have different size flanges. And then if she needs a shield, which can be a wonderful bridge to get the baby to suckle and give the mother confidence and let her get a good latch and get the baby a drink. So shields come in 3 different sizes: small, medium, small, extra small, and medium. Medela makes our shields that we use here, and we just want to review how to put the shield on once you've figured out the best size for the mother.
Do you want to talk about the size first?
Yes.
Just real quick.
Yeah.
When you're using the nipple sizing tool, it's helpful to have mom roll her nipple and stimulate it first before placing the tool over the nipple.
Yes, thank you. That's
Yep.
good information.
And you do actually want to allow just for a little bit more room around the nipple when you're looking at the sizing, because when most women are pumping, their nipples will expand in diameter. They will expand in diameter, and so you want to make sure that you're not going to size them just a little too small. So once I've had mom roll out her nipple and extend it, we take the nipple sizing tool. I don't have my glasses on.
It's okay.
Take the nipple
I'll
sizing
hold the
tool
breast for you.
and
There you
place
go.
it over the nipple like this. And really, you don't want any of the areola to be coming through. You only want the nipple
base of, yeah,
at the base of
base
the
of the
nipple.
nipple.
So with this nipple on our fake breast, the nipple size is 18 millimeters.
So she would be an extra small shield. So just for, or small.
A small
So
shield.
just for practicing, we want to just show you. So this is what we do when we're teaching our mamas. Express out the milk, couple of drops, frost the cupcake. Rox, if you hold the breast facing the video, then you show the mother the shield. This is what we say to our mama. Fold it down in half, open it like a little funky belly button, and pop it over the nipple and press. And then guard, or the guard of the nipple shield should be all the way seated down at the base of her nipple. You show them the shortcut that the mothers do. So by the time they've had the shield for a couple of feeds, the mothers tend to do this with the shield, which may not give them the best fit, which means that they might get sore, and it also means the baby might not get a good drink. So the mothers start, you want me to hold the breast again?
Yeah.
So the mothers do this when we walk in the room. They just take the shield, they fold it a little bit.
They don't even fold it.
Sometimes,
They
yeah, and they
put
just
it on
they just
the
put it over
nipple.
they just go like that. So please just remind the mom, let her do it. It's muscle memory. Take your breast, express the colostrum out, fold the shield down in about half, pop it over the nipple, and get a nice deep latch. Okay, we have a couple different breasts here. We're just trying to show you. So
fold it away.
Fold it away.
Into like a sombrero. Okay.
and pop
Place
it over.
over the nipple and then fold it back.
Perfect. And then the baby, open arms, brought in, tickle the baby's nose and lips with the end of the shield. And when the baby opens wide, you're going to glide the baby over the shield. It usually goes very well.
The baby still needs to open wide though.
Yep.
If the baby is not opening wide, what happens is the baby will latch just onto the nipple of the shield itself. And lots of times we'll see moms with flat nipples getting a lot of nipple damage because the baby is actually compressing the very end of the mother's nipple, so that the baby's not getting a deep latch, not stimulating and compressing the areola, still contributing to damage and causing trauma on the mom's nipples.
Okay, so we've gone over quite a few different things. I think that all of you are pretty well versed that we have our new little straws, our little supplementing straws that go on the purple syringes. So if mom is able to express some colostrum, whether it's just drops that you can suck up with a little 1 ml syringe, then give it to the baby, or a spoon. Rox and I still use just a spoon to hand express, or we have little colostrum containers. We don't want to overwhelm you with a lot of information right now. This is basically a new thing. Medela came out with them. They can actually go onto the flange area of a manual pump or the double electric, and it has a special little way to collect some colostrum. If mom is able to, we can give that to the baby for glucose issues, or she could just hand express every hour to 2 and let the baby lick and start doing some better nutritive feeds. So we have a few other tools to show you. Setting up the pump, some of you feel like we're going to be a little bit critiquing of you if you have tried the basics, wind up giving the mom a shield overnight. We come in the morning, you're like, you know, she really needs some follow-up. We would rather have you help mom hand express, get a shield out if needed, bridge that baby to the breast, support mom, and then we can start pumping at about 12 hours or so. We don't want her to feel overwhelmed, and we don't want her to rely just on the gadgets and the tools that may be needed, but she can also hand express, and that's going to give her a lot of positive assurance that she's going in the right direction. And then of course we can make a follow-up with her and see her. The more you do this and the more you help her and feel like you're more confident, she's going to feel that too. So keep praising her and supporting her. And I usually tell my moms, ring out for a latch check or latch assistance. And I always remind them, if they're a first-time mom, you're learning, you're on a new learning curve, and you're going to feel more comfortable in the next week or 2. It takes a while. A second or third time mom, I always say to them, you know, this is a different baby.
It's a new baby.
And you might have breastfed for 14 months and you're not remembering the beginning of that journey with that baby. So please ring out. And then I always tell them, then that helps your nurse to see a latch, document a feeding, which we know is important. And again, please remind them to look over their breastfeeding packet of info because there's some really good information in there.
And a lot of progress can happen over 12 to 24 hours. And so it's so important to, you know, reassure mom, like Linda said, but also be present for those feedings to see the progress that the baby is making, you know, and, you know, sometimes we just have to fine tune each feeding just a little bit to get the baby to really achieve that deep latch and also stimulate the breast so that it will help mom's milk come in.
So is there anything else that we wanted to, we don't want to, this is not like, you know, becoming an LC. We're trying to keep this, you know, kind of the first day or so at the bedside, especially the first few hours. But bonding is very important with mom and baby, skin to skin, hand expression, establishing a wide, deep latch, go over nipple care with her. Try to do your best job at sizing for the nipple if she does need
a pump,
manual pump, or a shield. Most moms use a shield, just so you know this, for about 2 to 3 weeks. So I don't overwhelm them with talking too much about, you know, it's going to be forever. I'll just say, you know, the first couple weeks, some moms do use a shield, and you can make an appointment and come back and see us. We'll talk about weaning from it. But I think that the best thing is really increase her confidence and support that mom and be positive with her. And women that feel supported and confidence building in those first day or 2, they tell us that they heard that, and it really makes a difference, that they felt supported.
Absolutely.
So what else do you want to add?
It's also important to talk with your patients about early feeding cues, right? Pointing them out, if the baby's rooting, trying to suck on their hands, sticking out their tongue. Those are all early feeding cues and the best time to put the baby to breast, even if the baby just nursed an hour ago. When moms do not have medication during their labor, they have an uncomplicated vaginal delivery, no epidural, no medications. Babies are very, very alert for the first like 8 hours, and they are rooting around searching for the breast frequently. And if moms honor those cues, keeping the baby in the kitchen, it helps them to really solidify their latching ability and to help build mom's confidence. So important. When you have babies that maybe did have a difficult delivery, or
a vacuum,
or a long epidural.
Yeah.
They may not be showing those feeding cues as readily, but it's still important to, instead of swaddling and putting in the bassinet and having them sitting across the room, for 3-hour breaks in between feeding attempts, doing as much skin to skin as possible while mom is awake and able. And if mom is not able and her partner is, then that's a great second option for skin to skin. And actually, what I kind of learned through just listening to some breastfeeding podcasts is that men actually and other partners do have oxytocin in their system, and when they do skin to skin with the baby in the first several hours after birth, it helps with their bonding as well.
Yeah. And I think that
imprinting.
The moms sometimes will say to us, I'm really tired, or the nurses will say, oh, this mom's exhausted. And we get that. We're not trying to be overly aggressive or assertive. We're just trying to plant the seeds that you have colostrum, you can hand express, and that baby should be offered a feeding every 2 to 3 hours. And I think most of the time we're doing a really good job of that. And if the mom is really exhausted, partners can put a glove on their index finger and let the baby suckle, not pinky, because we want the baby to learn to open wider. It's rare that a 9-pound baby opens like a 1-month-old, guys. So partners can put a glove on one finger and let the baby suckle on their finger upside down, which is soothing to give the mother a break. We know moms do need breaks. Moms should be reminded, just drink lots of water, keep filling up their water pitchers, tell them to eat extra calories, snack in between meals if they're hungry, and reach out with questions and concerns, okay? And I just glanced at our notes because I know we ad-libbed quite a bit, but it looks like we covered.
Yeah, and I just want to go over a couple of contents of the breastfeeding packet. I know Linda reviewed the feeding sheet, which is amazing. But I also wanted to show 2 other sheets in this packet. One of them is a resource page for your patients that says, let us help you achieve your breastfeeding goals. It's important for parents to have resources. So on this sheet, it includes the number for the birthplace, the number for the lactation connection, and also a great breastfeeding website. It's called kellymom.com, and it's all research-based breastfeeding information.
And it's excellent.
It's excellent. So if your mom is a Googler and she wants to look things up at 2 o'clock in the morning, this is the place to go. It's not, there's no bells and whistles about it. It's all accurate information from lactation consultants and doctors. And then the other one that is on here, which I find is particularly helpful, especially for our patient population with having multilingual patients, is La Leche League International. The patient can actually go to the website and change the language of the website and there's I forget how many languages, but it's probably like 40 or 50 different languages that are available on their website. So super great resource for them when they return home. So I like to show them this. And then the other thing that I do love to point out is this sheet called Baby's Second Night. For babes that are normal newborns, they go through a sleepy phase, usually starts 6 to 8 hours after birth. It could continue for that first 24 hours. Parents do need to wake the baby to feed. There's not as much on-demand feeding, and they're really trying to, remember, oh, when did I feed the baby last? I have to wake them up. And that is normal. But it also makes families feel like, my baby sleeps so great.
Well.
I hope this continues when we go home.
Yeah.
However, babies naturally, after that first 24 hours, they wake up, they get hungry, and they do want to do some cluster feeding. And this typically will happen on their second night as the sun goes down. Usually about 8 o'clock at night, 9 o'clock at night.
Yeah.
Adrenaline's now out of mom's system. She is really getting tired. If she's been entertaining visitors, and now she's alone and her baby is awake and wants to be at the breast a lot. It can feel overwhelming, and it can make new families feel like parent doesn't have enough milk.
Right.
But really is the baby's job to do that cluster feeding, to stimulate that supply, and it helps to bring in mom's milk over the next couple of days. So showing the family that we include this in the packet because it is very normal behavior. It happens to practically all babies. And to honor those feeding cues and put the baby to breast. And the baby may do some cluster feeding and need to nurse from both breasts a few times, and may do this hourly for several feedings in a row. But the upside is mom can hand express.
Mom could hand express.
If she needs a little bit of a break, she
Yep.
can hand express, and the partner could do a finger feeding if she needs just a break.
Yeah.
But it's important for them to know that it's normal
Normal
behavior.
newborn behavior.
And within a couple of days, the mom's body responds and the milk comes in.
And most moms do have enough milk for their babies. Most do.
Most do.
And last month we had about a 90% initiation of breastfeeding, but our exclusivity rates, we also track those. So we know sometimes babies do need a little formula, and donor milk is coming in May. So those options will be available for our mothers. And some of our ethnically diverse moms do want to do breast and bottle. That is a very strong cultural thing for them, but we still support them with both of those practices. So I think that we also hear when we call our moms, those cluster feedings can actually last that first week or so. And so moms need tools, and they need to feel supported that, oh yeah, I can hand express or use my hand pump, and my partner could do a little feeding during the night to give them that break. Because we don't, Roxanne and our goals are to have a mom feel supported and confident in her process. And that process is different for everybody. And so I think just those basics are so helpful. And we want our moms to feel supported no matter what they choose. And some of our moms may not want to breastfeed. And you know that Roxanne and I are strong supporters of whatever that mother wants. Fed is best, and support mom. And so we don't want a mom to not feel that, regardless of her choices. Her choices are hers, and we try to honor that. So I think that looks like most of our stuff on our notes.
On our basics.
On our basics.
Yep, so we're gonna conclude this video, and we'll do another short video about kind of breastfeeding, beyond breastfeeding, beyond the basics, incorporating, like, if you do have to get a mom started pumping, how to teach her to use the pump. Also, we have new colostrum collectors, which will be so great that we can use with the electric breast pump, so you're not searching for every last drop. They're going to be collected in a nice little container for mom, and that will really help to build her confidence as well. So we'll pause this video, and then we'll be back with some other tips for you.
Okay.